Fundamentally, the whole purpose of us being there in the Community Planning Partnership is ensuring that the communities get what they need.
The Community Empowerment Act provides a new legislative framework for community planning and community planning partnerships.
Is where all of the major organisations in Highland come together, and the senior officers of those organisations that can influence things to happen do sit around the same table and talk about what's really important for the people of Highland. So what's important to the people of the Highlands should be important to the CPP.
When you bring partners to the table and you do something together, it's much more effective. So you have much more resource in terms of people, which are really effective. You have a shared aim, a shared outcome, and it's all about working together to make a difference for the communities of the Highlands. So everything we do now in policing, I ask for that extra element of who else are we doing this with.
We work more closely together. We've become more experienced on what each other do, and therefore we have a right to view other things and actually share our views about that.
The Highland Community Planning Partnership brings together public agencies from across Highland to work with communities and create a vision to improve outcomes. That vision is expressed in a joint plan detailing the local outcomes they would like to achieve. This plan is currently called a Single Outcome Agreement, but will evolve under the new Act to become Local Outcome Improvement Plans.
Single Outcome Agreement is split into themes, and examples of the themes include outcomes for older people, early years, and safer and stronger communities. Essentially, everyone working together to reduce inequalities and improving the outcomes for all people and all communities in Highland.
The Highland CPP is structured into a board, a chief officers group, and a multitude of thematic strands, each composed of a variety of improvement groups and forums.
I'm the chair of the Safe Highland group. I'm also chair of the Alcohol and Drugs Partnership.
I have a role and responsibility as part of the partnership to represent the health and care aspects.
I lead for the council. I often chair the Community Planning Partnership meeting.
I represent the Scottish Fire and Rescue Service on the Community Planning Partnership and also chair the Antisocial Behaviour Group.
I am currently chairing the Health Inequalities and Physical Activity theme group.
My role is supporting the community planning partnerships.
In addition to attending the board and the chief officers group, I also attend a number of thematic different groups.
As the lead officer for care, education and health for children in Highland.
I think it's been really good at bringing together organisations to help to plan services.
There's many areas that we actually deliver similar activities and complementary activities.
It's about the potential to make a real difference.
It brings all the organisations together and allows them to sharpen our focus on what is actually important for the communities.
And actually, most of the work of the Community Planning Partnership is done out with the meetings. But it gets done because we trust each other, because we know each other.
I would say it's about people doing their day job, but more than their day job, trying to make a difference for the communities of the Highlands.
And that strategic join, which is led by the Community Planning Partnership, and that clarity about a shared collaborative approach is absolutely critical to the delivery of frontline services.
We have to do things differently, we have to do things better, we have to get the best use of the scarce resources that we have.
I think we have to move as a community planning partnership from being good strategic planners to actually engaging with communities around real community planning.
It shouldn't be prescriptive, so it shouldn't be about us going with ideas that we think will work, but in some ways it is starting off with communities with a blank sheet of paper and developing something together.
The challenge will be for organisations, including my own, to actually relinquish power and actually work with communities and the third sector and voluntary organisations to deliver services in a very, very different way.
And in that we need to recognise what it is we're expected to deliver, however what is it the communities want. And if the communities and what we are delivering don't meet, then it's just that creative thought around about what could we actually then do to close that gap.
But where there's challenges is great opportunities, because I think partners will start doing things they might not have necessarily done in the past, because they'll have to. They won't have the resource themselves. They will have to come to the table and work in partnership, combine resources, maybe combine budgets to try and deliver the same, if not a better service. So I think it's a real opportunity to break down some barriers that have existed for a while.